Massachusetts. The other area that drew me into the biomarker bill, which I did not file last session, it was filed by one of my colleagues who ran for a different office and is now successfully in that position, to the biomarker bill, was how cancer impacts my district in particular. When I became a new senator, I met with Dana-Farber Cancer, and they told me that I have the highest percentage of residents utilizing Dana-Farber. The closest Dana-Farber facility to my district is 75 miles away. That is something that's really telling. The Pioneer Valley in Western Massachusetts has a little bit higher rates of cancer than other areas of Massachusetts, but also because I represent a suburban district, my residents have the ability to get in their car and travel to Dana-Farber. Many of the low-income families in Western Massachusetts, particularly in Springfield and Chicopee, get their cancer treatments from Bay State Health, which is my largest private employer in my district. The Demore Cancer Research Center is wonderful, but we understand that not every insurer does what we're trying to do with this bill, which is provide that targeted coverage to allow folks to get the treatment that they need and that they deserve regardless of their income levels. And that's why this bill is so important and why I'm so pleased to partner with my colleague, Representative Kilcoyne. I know that we're going to have a question and answer period right after the presentation. Happy to answer any questions, but we're not just here today to describe what is in our bill, but also to make you become advocates. Representative democracy relies on people being engaged and a citizenry that is engaged in their political process. Each one of the bills that we file each session gets a public hearing. We want you to engage with your local legislators, with the people that represent you, to say how important this bill is so you can begin to advocate, so we can get this over the finish line this session, so people can have the expanded coverage necessary to get the treatment that they deserve. So I ask, when you leave today, I hope you don't just learn a little bit about what's in the bill, but you also take that and move it into action. And so we're happy to try to demystify the political process, to bring it closer to you so you can be more engaged in your government. Again, thank you for the opportunity to be here today, and I'm going to turn it back over to Representative Kilcoyne to go through some of these slides. Thanks again.
Thank you, Senator. Just a quick aside as well, one of the reasons that we always want to partner with somebody, senator or somebody in the House, is that we are in a bicameral system in the state of Massachusetts. Sort of similar to how the federal government works. We have to pass a bill both in the House and the Senate before it's laid before the governor. So it's very helpful to have a champion on both sides, both chambers. And so we're hoping, this session will work together to move this bill forward and hopefully over the finish line. But without further ado, let's get into the presentation because I think we're only on slide 2. But just to give you an overview, what are biomarkers? I know I'm speaking to an audience that probably is very well versed in science and the medicine behind it, but in case you aren't, biomarkers are tools in which we can measure the biological processes or diseases in blood tissue or bodily fluids, basically. And one of the reasons why we're working on primarily cancer, but and other rare diseases as well, biomarker testing, if it's able to be administered, allows doctors and providers to pinpoint exact, precise care to better inform them how to best treat that patient. Without access to biomarker testing, cancer treatment usually is trial and error. You would prescribe what was normally the standard of care, so a combination of radiation or chemotherapy or other drugs, and it might work, it might not. And then you would go through the trial and then determine how effective it would and critique that and maybe start again. That whole process can take months, maybe years. With biomarker testing, doctors can have the information necessary to know exactly what will be the best course of treatment. And for anybody that has seen a loved one or has gone through cancer treatments themselves, they know that the treatment can often be as taxing on the body as the disease itself. So the access to this medicine isn't just about figuring out best care, it's also about quality of life as well. There's a lot of research that also suggests that in addition to cancer, it can help with Alzheimer's, other rare diseases. This is incredible technology that can really unlock so many doors to really addressing some of the most devastating health consequences that affect our families and our communities and our societies. Unfortunately though, one of the reasons we're filing this bill is there's still a lot of challenges and barriers for many that prevent them from accessing this care. Senator Oliviera in his intro did a great job highlighting some of the disparities that we see in our own communities. Some insurance companies do cover access to treatment to biomarkers, but many don't. So roughly 40% of insurance companies do not cover that, including Mass Health, which many lower income people rely on for their insurance. So unless you have the resources and money to have a plan that covers this, you may not be able to access this treatment if you get a diagnosis for a rare disease or cancer. So one of the hopes with this bill is to really create equity in making sure everybody can. So this approach kind of highlights what I was talking about earlier. This visual kind of demonstrates how biomarker testing can affect care. So in the image above, you see that a group of people have the same disease, and if they're administered the same drug or the same standard of care, half might benefit from that, the other half may not have any benefit, and may have to reassess the treatment plan that their providers have. But with precision medicine and with biomarker-informed treatments, you can see that those same group of people with access to that testing can figure out what course of treatment will respond best for them. This is what we want to make sure that everybody can have the access towards. So everybody from the get-go can have the most efficient, precise care possible. Yeah.
The only I would add here, and you can move on to the next slide, Maddie. Looking at the next slide here, one of the benefits of a more targeted treatment isn't just the quality of life, although that's important. We all know that cancer treatments can be really taxing. They can be taxing on families, they're very taxing on the individual. If you can pinpoint that precise treatment, if half the people on that are getting the treatment for a kind of widespread blanket treatment, then they could be seriously injured by the side effects of that treatment that might not even affect the cancer that they're having. By having expanded biomarker testing, the quality of life standards for folks that are impacted by this can improve significantly. The pain and suffering of a family member that is going through treatment can be much more targeted, so they don't have to go through these rounds of treatments that impact their health further. And to the point I was trying to make earlier, how 55% of our budget in Massachusetts is spent on healthcare. Imagine how expensive it is to provide a treatment or coverage for a treatment that basically might not work. If you can pinpoint that treatment better, you can extract cost savings, not just for the insurers, but also for the taxpayer as well that is helping to do that. So it's not just about helping folks on the individual level, it's also helping out the efficiency of our system to contain costs and expand coverage.
Yeah. And I just want to piggyback on that point as well that the Senator made. Just two quick real-life examples that I experienced in working on this bill regarding quality of life. I was at a Chamber of Commerce meeting, all right? So this is not medicine related, nothing like this. This is, businesses that are there. And usually we'll go through the whole economic spiel and then, Q&A session, they ask, what bills are you working on? I talk about biomarker testing. A woman came up to me that lives in my area. She works for, she does happen to work for a hospital in the area, but she came up to me to tell me how she is a survivor of breast cancer. But the treatment that she received during that, without biomarker testing, the treatment to become a survivor of that cancer, aged her 20 years. Her doctor has told her that she's 42 years old, living in the body of a 62-year-old woman. That is 20 years off of her life. That was not from the disease itself, but from the treatment and and how that affected her body. So that right there, I think, just illustrates how critical this can be in ensuring not only during treatment is your quality of life better, but you can have better outcomes after care. And then quickly to go to the cost savings element that the Senator was talking about, that's actually something we really try to emphasize as well. The costs up front may be more expensive, but if you're eliminating unnecessary treatments, the long-term costs are going to be huge. Dana-Farber, actually, I was talking to a doctor at Dana-Farber who described that basically they have, for a specific type of cancer, a treatment that 99.9% efficiency and effectiveness in eliminating the cancer from the patient. I forget what cancer it is, but it costs $200,000 up front, and it's only effective for this one specific type. And they need to do biomarker testing to determine whether or not this particular treatment is appropriate for the patient. But without it, they can't administer this treatment at all because it's so expensive. If they can know before issuing treatment that this particularly new cutting-edge technology and that the research that they're doing will work on this patient, the long-term costs of that are huge. So just wanted to kind of use those two examples to the points the Senator raised as well. I think we're good on the next slide, right? Okay, so one thing that both the Senator and I want to make sure that you walk away from here is how our voices are just one of many that are necessary to make policy changes. And so we want to share two patient stories with you that have been really active in advocating with their own experiences with biomarker testing and how it improved their lives. The first we're going to hear from is Maggie. She's a young woman in Massachusetts that has done some incredible advocacy at the State House, and we really love you to hear her story. So we're going to play that video now. It's short, it's only like 2 minutes long.
There's one single video that's responsible.
Ignore the ads, guys.
2,000 regiments of permanently quitting.
Hi, my name is Maggie Buswick, and when I was 13 years old, I was diagnosed with papillary thyroid cancer. This diagnosis came as a surprise, where it's not typical in 13-year-olds, and I didn't have any symptoms. My doctor used biomarker testing to guide my treatment plan, and 9 years later, I'm cancer-free. The first part of my treatment was a complete thyroidectomy, where they removed my entire thyroid. The next step was radioactive iodine treatment, which would kill any straggling cancer cells in my body. Because at my age, the amount of radioactivity to be used in my treatment was debated by my care team. My biomarkers indicated that a higher level of radioactivity would benefit my health in the long term. So that's what we went with. Because of the levels of radioactivity in my body, no one in my family could come close to me. And when I got home from the hospital, I felt sick and lonely. It was rough, but thankfully it worked, and I remain cancer-free. I do still get anxious sometimes thinking about relapsing. But my biomarker testing gives my doctors precise tools to guide my treatment that keeps me cancer-free. And that definitely puts my mind at ease. I am privileged to have health insurance that covers the cost of the biomarker testing I need. I never had to question how I was going to pay for my cancer treatment, mostly because I was 13, but also because my parents could afford it. I know that's not true for everyone, but anyone that needs biomarker testing should be able to get it. One of the most heartbreaking aspects of having cancer as a young teenager was that my grandfather was fighting cancer at the same time. I got better, but he didn't. I know that he waited for me to be healthy before he left, but that made losing him even harder. I loved him so much, and he was only 68. Losing him at the same time that I got healthy is what motivates me to advocate for cancer patients everywhere. I'm excited to use my story to advocate for legislation that will increase access to biomarker testing across Massachusetts. I am hopeful that this legislation will allow cancer patients like myself and my grandfather to access the best testing and treatment regardless of their economic status.
So that was Maggie, and both of us have had the pleasure of meeting her. And she has shared her story with a number of stakeholders and policymakers, but we also want you to hear from one more. Jung is another cancer survivor that also relied on biomarker testing to shape her plan with her oncologist, so we'll hear her story next.
Hi, I'm Jung Han. I'm a lung cancer survivor, and biomarker testing played a crucial role in my survival. I was diagnosed during the pandemic. I had a chronic cough, and my doctor suspected I had COVID. But after a chest x-ray, she called me right away and said it looked like cancer. I was in shock. We lost my mother-in-law to cancer in 2013. She did not have biomarker testing options at that time. She suffered through multiple rounds of chemo that broke her body, soul, and mind, and ultimately her will to live. I was expecting the same fate. But I was lucky enough to be seen right away at a leading cancer research center. They diagnosed me as having stage 3 metastatic non-small cell lung cancer. My oncologist immediately ordered biomarker testing to determine what mutations might be part of my lung cancer. But my insurance company refused to cover the biomarker testing, calling it medically unnecessary. Fortunately, the cancer center fought with the insurance company on my behalf, and ultimately I wasn't left with the bill. The biomarker testing showed that I had an ALK mutation, which occurs in just 5% of lung cancer patients. Even though it's a rare mutation, there's a targeted medication for it that you take orally. It's been available since 2018, and it's about 83% effective for ALK patients. My oncologist started me on the targeted medication. After 6 months, my tumors had shrunk significantly. Today, I feel fantastic. I'm being monitored with scans every 2 months. I'm very active. I'm able to do everything I was able to do before. When I think back to my insurance company saying my biomarker testing was medically unnecessary, it's laughable. Without it, we wouldn't have known about the ALK mutation, and I wouldn't have received the targeted medication that has kept me alive. When I think about my mother-in-law's experience with cancer versus my own, it brings tears to my eyes. Nobody should suffer the way she did. I am so grateful for this second opportunity. I got to see my 2 children graduate from college last year, and I got to high-five my husband when we finally paid off the tuition bills. Without biomarker testing, I'm pretty sure I would have missed these milestones, and so much more.
I think what both stories illustrate, particularly Jung in the last one, without a biomarker testing, what Jung probably would have had to endure were rounds of chemotherapy treatment that would have impacted her quality of life, so that she would likely, lose her hair. She would likely face side effects that many people go through chemotherapy. She was able, because of biomarker testing, to get the targeted oral treatment that improved her quality of life, that allowed her to do that. We know with only 40% of insurers covering biomarker testing, and even if they do that, you need to battle with them sometimes, and 60% don't. That means 60% of people facing these types of cancer screenings will endure the pain and suffering that Jung was able to avoid. That's what makes this bill so important.
I think Jung's story also illustrates too how it's one thing for an insurance company to say, oh, well, this isn't necessary. But what if you're in that 5% that has a mutation? What if you're in even that 1%? Something that matters a lot, that you have access to all the information that your doctors can provide for you. And I also think one thing that both Maggie and Jung's story illustrate so importantly, both to a public audience and to other lawmakers like us, when you look at the bill we filed, it's written in code. It's basically statutory language. You're reading it and it's almost, plugging itself. You're not gonna get anything from it unless you're a lawyer or you know what statutes stand for. But stories like theirs really illustrate and drive home the personal and human results and reason why we file these bills. Even for our colleagues, we can talk to her blue in the face about what the actual language of the bill does, but you hear from Maggie and Jung and you understand immediately how this will help people in the Commonwealth and why it's so important to do this work. So, some of the key legislative efforts that we have in advancing this testing in Massachusetts is, as we've mentioned, we've kind of covered this a little bit already, but primarily the focus is to remove financial barriers. Senator Oliviera talked about his district and how you serve many of the lowest income people that are getting treated for cancer. Many of them probably don't have an insurance plan that will cover biomarker testing if they need it. We So that's one of the biggest things. The other thing is, if you actually do look at the statutory language of what we filed, one of the things our bill is removing is something called prior authorization. Anybody that's dealt with an insurance company probably knows this. Prior authorization means that a doctor can't administer it until his insurance company has already authorized it. So one of the big policy changes that we're trying to make is removing this requirement from biomarker testing. So if somebody comes in and they are diagnosed with cancer, a doctor doesn't have to, like Jung's doctor, get on the phone with an insurance company and basically argue with them with a patient's life in their hands. They'll be able to administer this without interference from the insurance company. And we believe that these changes in our bill will create more equity in Massachusetts, where regardless of your income, regardless of your insurance plan, you can access this testing if you get the most unthinkable news that you might get in your life. And so we want to also make sure we're touching on some of the role that non-scientists play in creating this policy. So you see I'm up there, Maggie and Jung are there too, and this gentleman also shared his story. This was the last session in July. We had an advocacy day in the State House. So Jake and I, Senator Oliviera and I are two of 200 legislators that serve in the State House. And in order to get anything done, in order to get any policy forward, we really need to make sure that the people that we work with are on board. And we also need them to understand why our bill will help people in their districts as well. Regional equity is a real thing in Massachusetts. I represent Central Mass, Senator Oliviera represents Western Mass. Neither of us represent Boston, but everybody throughout the Commonwealth knows people in their district that have struggled with cancer diagnosis and other rare disease issues. And so these patient stories help policymakers really understand the human impact and why this bill matters. At the end of the session, I believe we worked closely with the American Cancer Society that helps alert people that were in their network to call their legislators and let them know about the bill. And then we have outside stakeholders that are really invested in this as well. We've had some incredible advocates from the medicine field, Dana Farber, doctors, other organizations that really have stepped up to try to teach people, both within the State House and the public, why this is so important. And so some of the challenges, though, that we still face is, there's within Massachusetts, there is not standard policy when it comes to biomarker testing with insurance companies. In Massachusetts, 40% of commercial insurance plans are actually more restrictive than national guidelines. So one of the things that we're trying to do with this bill is change that. But obviously, we kind of touched on this earlier, healthcare costs in Massachusetts are extremely high. And so there's always a battle between what we believe will be the best care versus trying to balance what are ballooning costs for many in Massachusetts. And so one of the reasons we're here today is to hopefully give you a sense of how you can help, whether it's on this policy or others that you care about. We need your voice at the table. We need people that are not on Beacon Hill to become engaged and invested in this. And Senator, actually, you kind of outlined this in the beginning of our talk, why we need you guys. Maybe it's not biomarker testing, maybe it's another policy, but we are not people that are experts in this field. We rely on experts like yourself to teach us things about why technology like biomarkers are so important and why we have to make sure our policy reflects that critical nature in our healthcare. And so our hope is that you walk away from this, like the Senator you said earlier, demystifying some of the process and feeling more comfortable reaching out to whether it's city, state, or federal officials on issues that you care about, and that the work that you do here is able to be accessed to the most people that it can help. We have some of the top research in medicine in the country right here in Massachusetts, but not everybody can access it. Like you said, Senator, it's 75 miles to the best cancer research facility, and that can feel like, Massachusetts and California if you don't have access to a car or can't afford gasoline.
can I just add with that? The other area that we didn't mention right now is actually out, Massachusetts isn't seen as a rural state. However, when you look at a map of Massachusetts, there are many rural areas where access to either public transportation to get to and from a hospital center or a public health center can be like the dark side of the moon traveling to if you don't have access to that. So that's why this legislative session, we have tried to break down other barriers that people have to accessing healthcare. We've made regional transportation free for our 15 regional transportation agencies. So outside of Boston, outside the MBTA catch region, in my area, we have PVTA, the Pioneer Valley Regional Transit Authority. In Meg's area, Worcester Regional Transit Authority. So it's not just about impacting bills that are designed to tackle public health, it's about all the other wraparound services and support services that allow people to access healthcare. And when we're looking at this bill in particular, each bill, each legislative session has a public hearing. And I know that Rep. Kilcoyne, myself, and our staff will send out to folks here at EU when this bill gets a public hearing. I would encourage you to reach out to the chairs of whatever committee this lands in. So bills go through a committee process, a filter process. If you go back to Schoolhouse Rock and I'm just a bill sitting on Capitol Hill, it's very similar here in Massachusetts where that bill gets assigned to a certain policy committee. This past session, I had the privilege of being the vice chair of public health. In fact, in Massachusetts, we have 3 committees that deal with healthcare and insurance. And so depending on where this bill lands this session, we can let you know when that public window is open. If you feel compelled to travel to the State House and sit through a hearing and testify on why this is important, you can also likely testify this session via Zoom or a Teams link that's out there from the comfort of your own home. I'm hoping our rules will allow that this year. We haven't received our committee assignments yet, and we were just through bill filing. So each legislative session, there are nearly 8,000 bills filed by those 200 members of the legislature. Each one of those 8,000 bills gets assigned to a policy area committee over the next few months or so. And then over the next year, those committees will begin public hearings on these bills, including the biomarker bill. When that bill comes up, it'll likely go to one of 3 different legislative committees. Last session, it first went to financial services, and you're thinking, what does this have to do with financial services? Financial services used to be the committee on insurance, so a lot of insurance policy goes to financial services. The next stop on the way is healthcare financing. Said before, the important role that Massachusetts with our financing going towards healthcare in Massachusetts, it'll likely go to healthcare financing as another stop. And then public health deals with more global perspective issues that aren't necessarily budget or insurance related, but deal with the general public health of the population at large. We don't know what our committee assignments yet, but I can tell you right now, we plan to advocate for this bill, testify, but also hold lobby days working with the American Cancer Association to get people to Beacon Hill, to talk to your individual legislators, to ensure that they are educated on this. Because out of those 8,000 bills that are filed each session, only a handful get over the finish line. That's why your voice is so important in this process.
Absolutely. I do want to also just note, I know we haven't shared any pictures on the presentation of Senator Oliviera, but it's only because he's new to the bill. The senator that had previously filed it with me ran for a different seat at another office and that she got elected to, so she's no longer in the legislature. Although her name was Senator Sue Moran, she is a cancer survivor, so she was a great advocate, but very excited to work with Senator Oliviera on this as we go forward. And I think, I think that's the end of the presentation, and I think we have some time for some Q&A if anybody has any questions. Okay, go ahead.
Now, can I ask, if you don't have any questions, are most of you, who are students here? Students here?
Awesome.
Okay, we have students. Any faculty members here? Any faculty members? Anybody just from the general public that just showed up today? You couldn't get past security.
I know, I think that might be a little
Okay.
tricky, but if you come to the State House, everyone's welcome, so yeah, it's a little different security over there, but Nelson, I think you had a question?
Yeah, I want to start off thanking you, Representative Kilcoyne and Senator Oliviera, for coming to Boston University Medical School to tell us about your legislation. And you're speaking to a lot of scientists here and students who are doing research on biomarkers, the very thing you're talking about, trying to see which new genes could be good biomarkers, which ones might be misleading. How will this legislation help promote research in developing new biomarkers? And is there a way to, validate or put a gold stamp on which are really reliable, trustworthy biomarkers? Because I think, that might help the public come around to this if they know how reliable these biomarkers are, or how research here at BU Medical Campus and other cancer centers are helping to improve our understanding of biomarkers to make them more reliable for this type of healthcare support?
No, that's a great question, and I think something that we were hoping to kind of drive home just in how important your voice is to this whole process. If you couldn't tell, I am not a scientist, so I don't speak in scientific terms. I understand the human cost of it. I understand, and both of us kind of try to serve as a bridge between explaining how these technology, how the work you guys are doing right now can help the community at large and the public at large. So one of the most important things I think you can do is make sure that we have some of the information that you're working on. And maybe it's not us, right? I don't know, how many of you are from Massachusetts? So you could look up who you're represented by, and make sure you're sharing with them the work that you're doing, and that there's a bill out here that'll make sure that the advances that you're making with biomarker testing can be accessed by the entirety of the public. One thing that I kind of mentioned earlier when I first filed this bill is only in its third term. I filed it a very targeted way my first term because the technology was so new back in 2020 that the idea was we have to educate people on what this is and why it's important. We found that because it's been so effective, the momentum for this nationally really is picking up. So when I first filed it, I think one other state had, it's up to 25 now. Yeah, so we're kind of falling behind the 8 ball a little bit. So we really want to make sure we continue to be a leader here, and so we really want to not be, in the back end of the states that are recognizing its importance. But I think, one thing that I always find is when we have the opportunity to hear from people like you, and you're talking about specifically biomarker testing can lead to this outcome. Hearing things like this is 99% effective or even 80% effective in treating care and improving outcomes, you kind of get this reaction from even us and our colleagues oh my God, people need to access this, and we're not going to be able to achieve, and I think realize the full potential of biomarker testing until we understand this is a critical part of care. This isn't something an insurance company can dictate whether or not it's necessary. This is something that is necessary for all patients that are diagnosed with cancer. And we're finding not even just with cancer. There's huge research when it comes to Alzheimer's disease that we still are trying to find a cure for. So I think when you hear about the potential and the possibility for what this can lead to, it helps us exponentially. So we really do encourage you to share with what you're doing. If it's not with us, then with somebody who is in the state government that can really weigh in.
And I would just add to that, public policy has a ripple effect. Anytime a law is passed that requires something, it allows research institutions like BU, it allows the healthcare sector to say, Massachusetts, which has led healthcare, is putting down this marker, let's say, that we want to pursue greater research in biomarkers. It can be something for us, if insurers are covering it, that means more research will flow into it because they're gonna see that funding is going towards it. They're gonna see that Massachusetts is putting ourselves out there to say we're joining the chorus of those other states right now, and it'll show the research institutions and the insurance companies that exist that this is a priority of ours, which can hopefully help with the flow of dollars that come into BU. I think all of us right now saw this morning, and I don't wanna bring up national politics, but I have to bring it up. And that's the fact that a lot of the grants, a lot of the money that's flowing in, is put on pause by the new administration that's coming into DC. That disproportionately impacts Massachusetts, because what are we leaders in Massachusetts? 2 fields, healthcare and higher education. Where are most of those grants targeted? that are hitting the pause button right now in those two fields. So putting Massachusetts, by passing this bill, putting us as supporters of saying insurers need to cover biomarker testing can only help your research here by saying that more states are covering it, and hopefully nationwide it'll be something that's covered, which can help flow dollars back in to expand your research.
Right, and just quickly, I'd also add that, one of the barriers we discussed earlier is cost, right? Insurance companies say, this costs too much up front, I don't think you need it, you just go with a standard of care. But the research that you are all doing it shows that when it is used effectively, it can long-term lead to huge cost savings because you're not doing this unnecessary treatment and you're allowing people like John and Maddie to live fulfilling lives that don't require a lot of aftercare. So we have been trying to make the argument that this actually does save the Commonwealth money, and your voices can be critical in helping illustrate that. Yes?
I actually don't really know where to start.
Okay, that's okay.
You mentioned a few things like the prior authorization, the biomarker testing, like insurances, like making patients do like treatment.
Mhm.
Another one is like recommended by the doctor to be more, I don't know what it is.
Effective?
To be more
Yeah.
effective. And personally, my dad went through all of this,
Mhm.
and prior authorizations, I think, are a huge thing because by the time the insurance actually like approves something,
Yeah.
some cancers grow so fast.
Yeah.
And I think, I don't know if this is something you're working on, but
No,
like,
absolutely.
the actual diagnosis of a cancer can sometimes take months because
Yeah.
insurances don't want to pay. And so, people's like scans or like those expensive like MRIs and
Yeah.
any of those things that get rejected, and people's cancer is just, like your stage 1 or stage 2, stage 3. It can
Yeah.
even get to stage 4 depending on like how
Absolutely.
aggressive it is. And I think our biggest problem is that our insurances are for profit.
Yeah.
And I know that's a huge, like, it's gonna take a very long time to change, but they're profiting off of people's lives and
Yeah.
therefore they don't want to pay for these, like, saving, treatments and diagnoses. And like, I think a big thing is to also make sure these prior authorizations don't apply to diagnostic testing for
Yeah.
cancer or any like life-threatening conditions.
No, absolutely. First of all, I want to say I'm so sorry that your dad has gone through that. I hope he's doing okay. But I really thank you for sharing that because that's exactly why we filed this bill and why we're fighting for it. I think you highlighted a lot of the barriers and the obstacles that we are dealing with, right? Insurance companies are looking at their bottom line rather than patient care, rather than the most effectiveness of the most effective treatment, and not recognizing the struggle that it can be. And to your exact point, we've talked about this when we advocate for this bill. Prior authorization might seem like, oh, well, no big deal. The insurance company will sign off. You might have to go back and forth. That time can be critical in making sure that you're addressing cancer, and it can literally change it can have an effect on your life, basically. I talked about my aunt. She was diagnosed with pancreatic cancer. The only reason she's alive now is because her tumor was growing in like the exact spot where she got immediate symptoms. If it had been like a millimeter over, she wouldn't have known until it was too late. If she had to go through prior authorization and wait months for that to change, she probably wouldn't be with us today. So I think that's one of the biggest arguments that we're trying to make in getting rid of prior authorization for this is whatever cost argument insurance companies are trying to make, we're talking about saving lives, and time really is critical in that. So I really appreciate you sharing that, your own experiences with this, because it's a big reason on why we're fighting for this. And to your point about the larger environment of insurance companies, it's a big hurdle, and I agree that there's a lot of problems with healthcare, not just in Massachusetts, but nationally. One of the reasons why we filed this bill and targeted it in the way that we did is because sometimes, until you see some of those bigger changes, you have to try to be precise and intentional about how you're trying to kind of reform the system. You're not always going to get a big reform package through, but if you can kind of find a niche policy that maybe isn't so expansive but will make a huge difference like this one, it can move that needle forward. So there's still, even if we get this done, there's still a lot of work to do, but we think this is a realistic way that we can right now improve lives and outcomes here in Massachusetts.
I'll leave it there and see if there were any other questions.
And
For the folks who aren't Massachusetts voters, who would you suggest they reach out to about this sort of advocacy specifically for this bill or for other things that are affecting the state that they aren't necessarily able to vote?
yeah, no, great question. It's a hard thing sometimes to navigate because we don't get a lot of press on what's happening locally. I will say this bill has been introduced in, I think, almost every state. A good resource to start is, we both are working with the American Cancer Society on this bill. If you go to their website, they have a pretty good tracker of where this is at in state by state. So you can check your state, they should have information kind of more regionally, what's going on wherever you are a voter, whether it's been introduced, whether it's been passed, and if it hasn't been passed or introduced, who to best reach out to.
And I would just add to that, I don't usually subscribe to what, the courts have said states are laboratories of innovation. In this regard, they are. You look at what Massachusetts did in 2007 with universal health coverage, that became the springboard for a nationwide movement through Obamacare in 2009 and 2010 to provide universal access to health care at the federal level. You look at the PACT Act that I mentioned earlier, where I just described, we're capping costs of prescription drugs. Another component of that bill is holding accountable PBMs, pharmaceutical benefit managers, which even more than the insurance company, drive up the cost of prescription drugs. Now, because of what Massachusetts has passed to hold PBMs accountable, Senator Warren and Senator Hawley, two people who couldn't be farther apart on political issues, came together at the US Senate and have filed a bill to hold PBMs accountable. So things that we do here in Massachusetts can have ripple effects in other states, but also effects nationwide. So I encourage you to whatever state you live in or whatever place you live in right now, understand what your healthcare policies are in that state, contact those people that are in there and see what works. And that advocacy can be brought to the national level sometimes.
You mentioned that there are bills like this in other states, like California and New York. How far along are their proposed bills? And
So it's funny with this issue, you might think it might have some sort of political or partisan bias. We've seen it passed in states that are predominantly red and predominantly blue. I don't know off the top of my head the list, but I know as of the end of the session, we were up to like 23 states. Florida passed it, for instance. Illinois.
Louisiana.
Yeah, Louisiana. It's. I think it's one of those issues that I think whether you're in a political party, whether you're unenrolled, whether you never pay attention to politics, cancer doesn't discriminate, and disease doesn't discriminate, health doesn't discriminate. So I think on both sides of the aisle, there's been a consensus that this technology is worth creating access for.
so other states have already passed
Yeah.
it, but Massachusetts is behind?
We are hoping to change that.
Okay.
Like the senator said earlier, we passed both a big prescription drug bill and a huge healthcare bill aimed at driving down some costs. So I think the one thing that in Massachusetts that we do look towards is making sure we're kind of balancing things in a realistic way. Cost is a big factor, and unlike the federal government, we can't create a deficit. We have to balance our books every single year. So we've made some great momentum in the last few years. Like I said, the bill, as initially as I introduced it with Senator Moran back in 2020, or 2021 technically, it only addressed removing prior authorization for stage 3 and 4 cancers. We found that we got so much momentum with people learning about it. We saw it moving in other states. We expanded it to cover not just cancer, but other diseases as well. And at the end of last session, we did try to attach it as an amendment to a big healthcare bill that the House was debating. We were unsuccessful, but we managed to get about 80 co-sponsors of the bill, and we kind of made a last push, and I had legislators coming up to me and asking how they could be helpful. So where we haven't quite reached that ultimate goal, we have built a ton of momentum, and I'm really hopeful for this session that we'll finally be added to that list and not be behind, as you put it, Nelson. Any other questions? I know we threw a lot of policy making and stuff at you guys. We appreciate you listening to everything that we have to say today too. Oh, sorry, I didn't see you there. One more question.
Sorry. Is this specifically
look at how we define biomarkers in the legislation. I don't have it memorized off the top of my head. This is another reason why we need your voice at the table, because like I said, we're not, the doctors or the scientists administering, but
Yeah, the goal of the bill is to empower the doctors themselves that are providing the treatment. So our bill is more focused on forcing the insurance companies to actually, cover it. And I think we provide in there because there is some concern about, over testing that people can get. So what we want to do is empower doctors with this bill instead of empowering the insurance companies to deny it. That's where we're coming at the approach.
right. There are other instances where biomarker testing is administered for like certain blood tests and whatnot, but this specifically is aimed at times where insurance companies have the ability to deny doctors from providing this particular test. And whether, in terms of the specific of what that test is, we kind of defer to the doctors on what they are looking to do there.
Thank you.
Thank you. Thanks,
Thank you.
everybody.
Thank you again, Representative and Senator. I think our live stream failed, so I had to
Okay,
record it on the
I
phone.
saw you over there.
Yeah, so I
Your
set up the
forearm.
phone to record it. But thank you again for bringing this issue.
Yeah, no, this was great. We
And
love
like-
talking to people about this stuff.
Well, and like you're talking to the scientists developing these biomarker
Yeah, it's
tests.
amazing.
I'm doing biomarker testing for Alzheimer's. Dr. Gershow's doing biomarker.
So I should have
for-
mentioned this too. We have we got the support last session of the Alzheimer's Association of Massachusetts.
okay.
So they're
Yeah.
endorsing this bill primarily
Great.
probably because of the research that you're doing.
Well, there's also the Lemberg Lab, the Pulmonary Center is doing a lot of lung cancer research, biomarker development. But a lot of this is fluid science.
I know.
The biomarker
I should've-
technology is still new. Some of them
Yeah.
are really good, some of them are really bad.
Well, and that's just
So-
one of the things, and I should have probably mentioned this because one of the intersections I think between the work that you're doing in the science field and what
Yeah.
we do is there are different advocacy groups that are more educated on some of the science and what is worth investing in
Yeah.
versus not. So Alzheimer's Association is a good example
Exactly.
where it's people that are an organization whose dedicated purpose is lobbying.
Yeah.
So they can understand and they can read research like the one you're doing
Right.
and understand, okay, this actually should be a priority for us because it can lead to better outcomes and it's a realistic policy.
And if the bill can bring research dollars back to Massachusetts,
Right.
that might be more palatable to the state taxpayers.
Right,
If we,
yeah.
if we can bring more funding for our laboratories here to do research, that would be great.
Yeah,
You know,
no,
help
that's the
cause.
hope, yeah.
That's the hope.
But,
Well, there are other people. Let them ask
of
you.
course. Hi.
Barbara Schreiber, nice.
Hi, Barbara, nice to meet you.
Oh, yeah.
Yeah, I am.